welcome everybody in the room and also, as it were, virtually. Yeah, so it gives me great pleasure to sort of have organised this symposium. As I said, Dr. David Gruen will speak first about data integration and linkage in Australia, where I think there's been enormous advances, and then we'll have a discussion about the relevance for the UK and hopefully a bit of a two-way dialogue, because obviously there's been very important initiatives in the UK where I think Australia can learn from and vice versa. So perhaps, and if anyone has seen a talk from me, I generally take a historical perspective, and in this case, quite an historical perspective, and trying to link together the various elements. And what people might be interested to learn is that Florence Nightingale not only did work in hygiene and for nursing, but she also did a lot of work for statistics, including the idea of sort of sponsoring or funding the first chair in statistics at Oxford University. And she offered, towards the end of her life, a substantial endowment, but the university actually didn't accept the endowment, as it were, which was, I think, has been or a sort of a problem ever since, as it were. But in terms of what the purpose of it was, that she asserted that many problems of medical hygiene, social welfare, and even political action failed to attain satisfactory solutions because there was no adequate training in statistical science. And so she went so far as to affirm that, and I've changed the language slightly here, humans could only ascertain the mind and purpose of the deity by studying his or / her laws as exhibited statistically. So she had a view that the truth of the deity is out there, and we just need statistics to really understand what to really understand our sort of purpose in life. Now, one of the areas she was interested in applying statistics, which of course links this talk with Australia, was she had a real concern for Indigenous Australians and more generally, as it were, she called it sort of native races. She was concerned about the very high mortality rates, and obviously reports were reaching England by this stage. She never travelled to Australia. And she raised the possibility of entire races dying out, which I think you'd use the modern phrase Indigenous genocide. And so she wanted to do something about it. And being interested in statistics, she wrote to various colonial officers, sent out questionnaires to obtain data on mortality rates. And basically, but the data she got back, which she analysed herself, was so bad, she described it as scrofulous returns because the data was so poor and the methods of collection so disparate. And actually, interestingly, she even gave a talk to, I think, the Royal Society on the sort of, Aboriginal races in Australia, where she talked about some of these issues. Now, interestingly, in Australia, I think obviously has quite a historical past, and one might say a problematic historical past. And one of that was that Indigenous people prior to 1967 were not counted as Australian, or certainly full-blooded Indigenous, and that was because of the Constitution, which was founded on the idea of what was called terra nullius, which was that there was unoccupied land. The first settlers didn't need to have any sort of treaty with the sort of Indigenous Australians. Now, I'm very pleased to say that that was actually removed from the Constitution in a referendum in 1967, but that allowed the statistical agencies to count, as well as giving powers to government agencies for special laws for Indigenous Australians, which the Commonwealth has exercised ever since. But I think what also has then been problematic, once you're kind of counting Australians and looking at mortality, which goes back to Florence Nightingale, that is what are the gaps, and they were considerable. Now, the estimates prior to 2005 were and by various means, were around 17, which is enormous, with Indigenous life expectancy. And one of the real pushes for data linkage to improve statistics in Australia was from the Australian Bureau of Statistics to link the census with mortality data, because you could get Indigenous status from the census and then you could get mortality data. And by linking the two, you could create much more accurate life tables, which they did. And statistically, they closed that gap by 6 years, which is quite an achievement. But of course, it's just saying we've got rid of the error. So we now know what the gap is, which is around 10 or 11 years. And to put that into a UK context, that's about the gap between being in the lowest multiple deprivation or classified lowest multiple deprivation to the highest multiple deprivation. In the UK, it's about 10 years for men, about 7 years for women. Here, it's about 11 and 9 years. So it's similar sort of magnitudes. And of course, then the real challenge begins, and that's been a challenge ever since. And perhaps one of the things that has been very refreshing in terms of trying to rise to this challenge has been the recent availability of linked data, integrated data. And I attended a workshop at the ANU earlier this year, and the excitement where for the first time we're able to link a whole lots of data sets to look at this question and a whole lot of other questions, I think has been really important. And critical to that, making that happen has been, of course, David Gruen, I don't know, who has 2 PhDs, and I don't know whether one should call doctor or doctors, but but they're quite separate. In one from Cambridge in physiology and another one in economics, has over 80 articles. So obviously an academic career, as it were, but has also worked in the Reserve Bank, Treasury, Prime Minister and Cabinet, and now the Australian statistician, and really has been instrumental in transforming the data landscape in Australia. So without further ado, I'll hand it over to David, and I will then just try and deal with the technology, which, if you give me 1 second, so I'll stop sharing that and talk. Start sharing this. And hopefully, is that, are we there? No. Good, perfect, thank you. Thank you very much.
Well, nice to be here. And I'm not sure I've got anything to say about Florence Nightingale, but I did learn something from that introduction. So I'm not sure. Perhaps she should have. I don't know if she couldn't get Oxford to take up her offer. Maybe she should have tried funding it in Australia. Maybe we would have been more accommodating. I don't know the answer to that question, but kind of interesting. So Philip sent me an email several months ago and said, would it be possible to give a seminar in this series, and that he could accommodate virtual if that would be easier. And I said, well, it turns out I'm going to be in Europe in late June. So we picked a day, and today is that day. So very, very glad to be here. And what I'm going to talk about is the rise of integrated data assets in Australia, and 2 integrated data assets in particular, which I will talk about in some detail. So first, I'm going to provide a little bit of a history of the developments of the 2 largest and most extensive integrated data assets in Australia, and then give some examples of public policy questions that are now being tackled using those assets. And then I'm going to end with kind of my ingredients for having a successful integrated data asset and generating support for it. So the integrated data assets that I'm going to talk about go by 5-letter acronyms, of course. One is called BLADE and the other is called PLIDA, and I'll explain what they are. Let me give you a picture of these. This is the first one. So BLADE stands for Business Longitudinal Analysis Data Environment. I've often wondered whether you could make these catchier, but it is what it is. And at least it's got business in the title, which gives you a sense. So the point about the Business Longitudinal Analysis Data Environment is that it has a business spine, which means that all these data sets are linked, and so in other words, in a de-identified way, you know that this particular unit record in this data asset is the same business as this unit record in this data asset, and you can do it across a large number. This data set has data, both of these data sets are longitudinal. They have the core data sets in BLADE span the years from 2001 to this year. And there are about, and I don't know how many of those you can read, but you can hopefully read most of them. I can't tell you what's in every one of those data assets, but you get a sense of the sort of range of things that are in this data set. There are a couple there which I've got a plus against them, which means they're not yet in the data set, but we've got support to add them. So that's the BLADE data asset. And then the other one, which is the people-centered data asset, which is now called person-level integrated data asset, it looks like this. And this has got a range of information about individuals from the tax office, so that's the purple ones, from the education department, from the health department, information on disability, migrants, population, including the census and the deaths registry. And then the social support one is people who've had unemployment benefits or single parent benefits, all of that sort of thing. So it's of the order of 30 data assets that are linked up, and we're in the process of adding new ones. In some work that we're doing on climate change, the Climate Change Authority is very interested in getting access to insurance data to get a sense of what's happening to house insurance, and for that matter, property insurance. And so we're going to be linking that to this data set. And one development which matters for us is that this is largely a federal government data asset, but we are trying to get access to the state government data. And we have a pilot with the Australian Capital Territory in South Australia to start integrating their state data on health and education with the Commonwealth. And the aim would be, that's a pilot, but the aim will be, once we've demonstrated that the world doesn't come to an end, the other states and territories will be interested in joining it. So that's the plan. And since I wrote the paper and finished it 2 weeks ago, we've just been funded to add a criminal justice data asset to this. So that links up prisons, police, and correctional services from all the states and territories. And so that's a data asset that we're in the process of linking up. So those are the two data assets I'm going to talk about in some detail and talk about how they came about. I think you had Sir Bill English speak at an earlier one of these not that long ago, and there's no question that what was being done in New Zealand a decade ago or more was influential in helping in Australia coming to the view that perhaps we should do something similar. And he was certainly very influential in New Zealand in driving integrated data in New Zealand. Anyway, support for data integration in Australia kind of built gradually, and there's no question New Zealand was influential. I have a timeline with some of the key dates. So you always want to ask, what do you want to put in the timeline? Otherwise, you could put an awful lot of things in. But the Australian Bureau of Statistics announced the intention to start census-based data integration following the 2011 census in 2005. So that was a reasonably that was influential. And then around about 2010, there were a bunch of senior boards that basically expressed support at a high level for the idea of data integration. And that just shows you a bit about what happened. The critical date is 2015, and I want to tell you a little bit about what happened in that day on that day. Oh, by the way, I have written this up as a speech, and it's on the ABS website. And since Australia has the 26th of June before Britain does, it's already there. So, for whatever reason. In 2015, and I wanted to go to the trouble of actually naming the people who were responsible for actually starting this off, and I'm not going to read their names out here, but it's in the talk. So PLIDA was started by two relatively junior people, one in the Bureau of Statistics and one in the Department of Industry and Science, who knew enough about it to put together a few data sets, and all they needed was to convince somebody to give them $5 million. And the department happened to have $5 million, and that started PLIDA. So it wasn't actually called PLIDA to begin with, but that's neither here nor there. So in 2015, PLIDA started with a small number of business data sets that were linked together in the ABS. When it comes to the person-level integrated data asset, there were 4 key agencies and people at different levels in those agencies who basically came together and said we ought to do something like this. And they also started small. And so the person level one started with, I think it's five data sets: Social Security, personal income tax, Medicare benefits, Medicare enrollments, and the census. So they started with those 5 data sets, and there was nervousness about being too explicit about the fact that they were linking people together. So they called it the Multi-Agency Data Integration Project. They didn't mention anything to do with people, despite the fact that it's got very strong privacy protections to make sure that people's individual circumstances are not revealed. But anyway, that was the name. And when I turned up, which was in 2019, I said, what is this? It doesn't tell you what this thing is. So we changed the name to Person Level Integrated Data Asset, which actually explains what the point is. So I want to talk about that. That was very much the beginning, and it was very small. And so I want to talk about the things that took us from the beginning to where we are now. The first was having a trusted access model. So if you're going to allow people to get access to these powerful integrated data assets, you have to have a framework which makes people comfortable with the idea that you've taken security seriously. And it turns out that there's a professor from the University of the West of England, Bristol, who came up with a framework called the 5 Safes framework. And we invited him out to Australia to talk about the 5 Safes framework. And I'm not going to go into great detail about that. There's a link in the paper, but the idea is that you want to be careful about the people you allow into the system. You want to be careful about the data. You want to be careful about the infrastructure, and you want to be careful about the outputs. So you're not going to let things out of this secure environment without being sure that they don't re-identify anything. So it's a kind of it's a calculated risk kind of approach. So that was the first critical advance. The second was the development of the infrastructure that was going to allow researchers to get access to these data, and that started. The name is Data Lab, and it started as a secure facility, but you had to drive to an ABS office to use it. So there are ABS offices in all the capital cities of Australia, but you had to turn up and sit in a windowless room and do the work there. And then within a year, we made it virtual. And within 3 years, we allowed academics to get access to this data. Again, they had to tell us what the public policy benefit was from the research they were going to do, but we allowed academics to do it who were not affiliated with a government agency. And then the other thing we did was put it in the cloud, put the technology in the cloud, which makes it scalable. And that has led to if you go back to 2015 or 2016, there are a few projects. There are now 350 active projects using these data. The numbers are at the end. As of April this year, there are 180 projects using PLIDA, 99 using BLADE, and 68 using both. And where do these people come from? So the answer is about half are university projects, about a third are government projects, and the remainder are internal ABS projects and projects undertaken by think tanks. So that's the breakdown. The other thing that was critical was that there was a gradual appreciation in the senior echelons of the public service that data integration was a good thing. And one of the things I draw attention to is that not everybody was convinced. And part of the process of senior public servants becoming comfortable with this is that some retired, and the people who took their place were more comfortable. And I don't know whether you know the Max Planck aphorism about science, but he said this: a new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die, and a and a new generation grows up that is familiar with it. And there is an element of that. There are people in senior positions who would say, this is a tremendously good idea. And then whenever you had a specific example, that particular one wasn't. And so it was quite important to see them out. No, I'm serious. That is part of winning this argument. You will not convince. There are some people you will not convince. And you have to find ways to find other people. I'm not suggesting murder, just in case anyone is wondering. This is not a, I know this is a health unit, so I wouldn't possibly suggest. Anyway, but I want to be clear with you. You will not convince everybody that this is a good idea. And I'm sure there are some people still in the system who don't think it's a good idea, but they're declining numbers. Then you need money, and because integrated data assets are expensive, they generate huge amounts of value, but they're not cheap. And especially ours are in the cloud, and cloud costs are not trivial. And if you want to update the assets frequently, which has huge benefits, that's also expensive. The arrival of COVID was very important because all of a sudden there were a whole lot of urgent public policy questions which integrated data could tackle, and that was very important. And the final thing that has really mattered is that the team that does this in the ABS has gradually developed expertise in how to integrate data assets, how to maintain data privacy, negotiate for new data assets, and provide support for the increasing number of people who want to use them. We've got 1,700 active researchers from government and universities that are currently using them. So now let me talk a little bit about some of the things that have been this has been used for. So in the early phase of the pandemic, the Treasury wanted us to link together links with employers and between employees and employers to understand the flow between employment and the range of support payments that have been put in place for COVID. And amongst other things, it enabled Treasury to have a detailed understanding of labour market outcomes when it was providing advice about when to wind them down. So we could give them relatively up-to-date information about the flows of people in and out of these big social support payments and where they were going. Were they going into unemployment? Were they going into... So that gave them a level of confidence that the labour market was functioning in a way that meant you could turn the really big social programs off, which is what they did. They're now using the labour market. You end up finding interesting things you can do that you didn't expect. So I'll give you an example. Our competition regulator is called the ACCC, the Australian Consumer and Competition Commission. And they have access to information on mergers, but only a small proportion of mergers in the economy, not all. And you could change the law so that they have to be told about every merger in the country. But what they've done with the integrated data is follow labour flows. And when a significant number of people from two companies end up in one company, the algorithm can tell you it's a merger. And so they can use this integrated data to give you a much better sense of mergers that are going on in the economy. And they're going to do that in a way that enables people to do economic analysis on the mergers. To give a completely different example, analysts are using BLADE and PLIDA to track the contribution over time of Aboriginal and Torres Strait Islander businesses on employment in the economy. And because it's longitudinal, you can get a sense of how that's changing. And it's both, some of them are sole traders, some of them are employing other people. But basically, you can see how something like that can give you a sense of the increasing footprint of Indigenous businesses in the economy. So that's another example. The one I like in particular, there was a person in the health department who had worked in the ABS and understood the power of integrated data and what was possible. And the people who were doing the COVID vaccinations in the Department of Health said, we would like to collect a whole lot of information about people when we give them a vaccination, so we can track which ones are which groups in the community have got good take up and which groups don't. And they were thinking of having this long questionnaire that you were going to have to fill in before you got a vaccination. And he said, don't do that. We'll integrate it. And they said, I have no idea what you're talking about. And so what we did was we integrated the Australian Immunisation Register with PLIDA, which includes the census. And so by doing that, you can work out what people's ancestry is or what their ethnicity is. Don't ask exactly about where their parents came from. And the old model was we updated the data every year, and COVID, this bloke who knew a bit about it said, how about weekly? And so we worked out how to do that, and we updated the data weekly, so you got real-time information about uptake of vaccines. And here's the results as of the middle of 2022. So if you look at the bottom, MeMo general population, this shows you the coverage of the first, second, and third doses of COVID vaccination. And you can see almost everybody had one or two, and over 70% of the general population had three. But you can look at these other groups of language groups or country of birth, and you can see that they're much lower. So the health department had this information a couple of weeks after the time. So this is as of the 17th of July, but we could give it to them 2 weeks later, right? And they could, or on the basis of that, they could run campaigns in those language groups to try and raise explain what the benefits of vaccinations were, and we could do it geographically as well. We could give them that sort of information. So that's a sort of very concrete example of what you can use it for. And the same linkage was used by an academic study to look at all-cause mortality of people by vaccination status. And they demonstrate, and you've got a huge amount of data, so they demonstrated that they followed 3.8 million Australians over 65, and I immediately asked, how many Australians are there over 65? And the answer is slightly more than 3.8 million, but not a lot more. They followed these people and were able to demonstrate that if you'd had three vaccinations with the most recent one within the last 3 months, it reduced your mortality relative to an unvaccinated person by 93%. So you can get very detailed information from using these integrated data assets. Okay. Both. They looked at both, but they also looked at all cause. The 93%, I think, no, that was the COVID. That was the COVID. Yeah, that was the COVID. You're right. Okay. So, so let me sum up. I thought I would provide some ingredients to build and grow high quality public sector integrated data assets, give you some my kind of summary. So I wrote my conclusion and then put it into ChatGPT and asked ChatGPT to come up with 8 dot points, and then I edited it a little bit. But some of them are straight out of ChatGPT and some of them are me. And we're not going to do a test afterwards about which is which. Okay, so the first one is you need people in the system to propose integrated data projects, and often those people are quite junior. They're not because you want things that are actually going to generate some payoff relatively quickly that are going to provide a benefit. So so that's the first of my of the things that I think are necessary to succeed. The second is you need senior support from government and senior public servants, and that support has to be both in public but also when specific projects come up. It's all very well to have support in general, but you need support in the specific cases. You need broad community recognition that the benefits outweigh the risks. You're doing something that's pretty new, and It's putting together data from a wide range of places, and you are doing things as carefully as you possibly can and making sure that the risks are managed. But you need the community broadly to regard this as a legitimate thing to do, because otherwise this won't work. Fourth thing is, I think you should start small and demonstrate value and build from there. Don't do a big bang, I don't think, because you're building something that's big and expensive, and it makes sense to do it incrementally. My fifth one is that it has to be seen as a partnership. The data custodians, and they're all over the place, right? The organisation that does this integration is relying on the health department, the education department, the tax office to be willing to share their data, and they have to share an interest in the success of this project rather than feeling it's being imposed upon them. And if you don't have that, a few years down the track, it'll just get pulled. Something will get pulled. You need a sustainable funding source, because if you just have an initial big bang and then the money dries up, well, it'll get closed. These assets are only useful if they're kept up to date, and that costs money. You need to persevere to overcome resistance and maintain support. One of the things that is a blocker is that people who are data custodians understand that some pesky researcher will find something that is inconvenient for the government of the day. That is quite possible, and that can be a reason, although they're not explicit about it, for not doing the data integration in the first place. And it's important for the people who believe in this stuff to persevere and just keep working at it, because otherwise you don't get there. And then finally, you want a growing pool of skilled analysts to extract policy insights. And the reason you need that is because this stuff is not totally straightforward. It's not like running an Excel spreadsheet. And so you do need to build up a coterie of people who can use this stuff and demonstrate to the people who are making decisions that it can provide insights that you can't provide any other way. Thank you very much.